Lung cancer was considered to be rare among women, but starting from 60, there is an increase in number, an increase in incidence and mortality. And nowadays, in many countries in the world, for instance in US, lung cancer is the first cause of cancer death also among women. So it's important to the diffusion of awareness about this disease.
Lung cancer is related to smoking in 85% of the cases, so it's important to stress these figures. So women are now smoking every time more here in Europe, and we have to give a clear message about this figure.
Young girls are smoking a lot, and in many countries, for instance in Europe, the percentage of a young girl smoking, if we take a picture at 15 years old, is higher compared to the adult counterpart. And this is an issue because in many countries in Europe there are no specific programs supported by the healthcare system in school or a sort of smoking cessation or a smoking campaign, so we have to insist and to invest a lot in this field.
There are also lung cancer in never smoker. We have presented here at this meeting our experience in Spain is a database with information of 2,000 women with lung cancer diagnosed in Spain, and we have analyzed epidemiological characteristics of the never smoking women with lung cancer. What we have learned from this experience is that 50% of these women have an EGFR mutation, and also we have learned that 40% of these women were second-hand smokers.
There are some interesting points to underline in terms of gender differences. For instance, there is a different response to therapy independently from the stage of the disease, from the type of the disease, from the type of therapy, being surgery or radiotherapy or chemotherapy or targeted therapies. We have some publications showing that women do better, so the outcome is better in women having lung cancer. Unfortunately, the majority of the data are coming from retrospective data and from small sample size, so we need the prospective and the randomized clinical trials, but we are starting very well because the majority of randomized clinical trials have the gender as a stratification factor, so we will learn more about this point. Unfortunately, this is with a worse toxicity profile, so a better response together with a worse toxicity profile. But this is probably due to the mechanism of action behind these gender differences, because one opinion and one possibility is a different DNA repair in the DNA repair machine. So probably the women repair differently from men, and this could be the reason why the outcome, for instance, with platinum-based therapy is different compared to men, and this is the reason why of a different toxicity profile.
We have to explain that lung cancer is not a male disease. So at present, approximately 30% of all lung cancers diagnosed in Europe are diagnosed in women. This is the situation in Europe. In the States, lung cancer in women causes more death than breast cancer. So everybody should be aware about the relevance to stop smoking, because it's the reason of one of the most important reasons of cancer-related death nowadays.